Hello, I am Dorela Kokthi, a speech and language therapist and PhD candidate from the University of Medicine, Tirana, Albania. I am pleased to present my paper on the topic Literature Review of Orofacial Praxis Skills in Children with Autism Spectrum Disorder. This is the table of contents, and let's begin. What is praxis? Praxis is the skill that enables you to plan, organize, and execute complex motor tasks essential for everyday activities and learning. It's important not just for moving, but for functioning independently and successfully in daily life. Understanding praxis, its definition, importance, development, assessment, and intervention can greatly improve therapeutic practices. Assessing praxis is important. It helps identify where your child might struggle with motor planning and execution. Through targeted assessment, therapists can pinpoint specific difficulties in the sequence of conceptualizing and performing tasks. This is crucial for effective interventions. Methods. This paper uses an extensive literature review to gather information pertaining to the orofacial praxis skills of children with autism spectrum disorder. For this review, peer-reviewed journal articles, clinical case studies, and pertinent textbooks published between 2008 and 2024 were sourced from academic databases like PubMed and Scopus. The studies selected for the review were centered on assessment underlying neuroscience and therapeutic approaches to motor planning orofacial tasks for children with ASD. There are four main components of praxis that are important to understand in order to better assist the child in improving the praxis skills. Ideation is a key component of praxis. It involves the ability to conceive original ideas for performing tasks or solving problems. Motor planning. After ideation, you will need to develop a motor plan, which is an essential step in determining how the body moves through the space. Execution. The third component of praxis requires to combine and perform the correct sequence of steps in a task, ensuring each movement flows smoothly into the next. This aspect is essential because it's where the activity planning comes to life through movement, coordination, and action sequences. Feedback and adaptation. Once the child has begun to master the execution of a task, feedback and adaptation plays an important role in refining their movements and enhancing overall skill. Praxis requires repetition. To master new motor skills, the child will need to practice them repeatedly. Repetition isn't just about doing the same thing over and over, it's an essential part of the learning process that enhances motor coordination and underpins skill development. Consistent practice is so important because of repetition benefits, skill development, practice importance, and motor coordination. About autism. Autism spectrum disorder is a term used to describe a neurodevelopment condition characterized by the presence of the three clinical signs: impaired communication, impaired social interaction, and restricted repetitive and stereotype patterns of behavior of interest. Recent studies have evaluated other development areas which are frequently observed and assessed in individuals with ASD, such as motor and praxis skills, play, or adaptive functioning, may limit the child's ability to interact and participate successfully in the environment. They are part of the central elements of the ASD diagnosis and have been categorized as associated features. One of these associated characteristics that has been frequently observed in children with ASD and that hinders social and communicative skills is praxis difficulties. Observation of difficulties in praxis and play may help to understand the cognitive, communication, or social skills difficulties experienced by children with neurodevelopment disorders. The symptoms forming the clinical picture of the ASD comprise both specific and unspecific symptoms, purposely determining the child's psychosocial development. One of the distinct exhibitions of this disorder is an impairment of affective communication activity, which is obvious in preverbal vocalization and determines the ontogenesis of communication. Other typical symptom in particular is the period of the so-called imitative babbling postcanonial vocalization, is the absence of the preference of preverbal vocalization as the incentive of communication. The development of motor activity is extraordinarily important not only for speech but also for the development of cognitive abilities, social behavior, etc. If we understand the process of speaking, that is, speech as a mechanical act, we can notice that it concerns precisely coordinated process of soft motor activity of the speech apparatus. Oromotor skills are crucial for speech production and involve the coordination of muscles in the mouth, face, and respiratory system. Deficits in oromotor skills can lead to difficulties in articulation and phonation. Oromotor skills. Oromotor skills, children with ASD show greater difficulties in oromotor coordination. Oral sensory processing. Children with ASD exhibit a higher prevalence of oral sensory issues, including hypersensitivity to certain textures and tastes. Feeding behaviors are more pronounced in children with ASD, with displaying selective eating behaviors. Praxis skills. Children with ASD show significant challenges in motor planning and execution, impacting the ability to perform coordinated feeding action. Some data, approximately 80% of children with autism spectrum disorder demonstrate deficits in aspects of motor performance and praxis. However, motor impairments are not a diagnostic criteria. In praxis skills, children with ASD perform worse than children with the development coordination disorder. And there is a quote by Highland Moss: "Autism is not a language barrier, it is a different language." There are some factors to consider when working with children with autism. Nutrition. The analysis of the nutritional needs of the child, together with the assessment of oral sensory motor skill, allow the team to set a diet that takes into account the skills of the child and the nutritional value. Oral motor abilities or motor skills for reading are a complex set of fine motor skills. The literature outlines oral motor difficulties in children with ASD. Sensory functions. Multiple studies have reported the relation between somatosensory discrimination and praxis. Research has shown that many individuals with ASD have praxis and imitation difficulties, including orofacial imitation. Respiratory processes. Issues with breathing are reported to be present in up to 25% of children with autism. The accumulation of secretion, breathing by the mouth, and respiratory effort can impact the feeding and speech process. Communication and social skills. Children with ASD are more likely to present with development delays in the areas of speech and social interaction. Psychological factors. Children with ASD commonly engage in repetitive and ritualistic behavior. Consequently, they are more likely than typically development children to insist on a ritualistic mealtime. Development of oral motor skills. Oral motor ontogeny follows a stepwise progression, building on the suckle reflex to acquire the more complex oral motor milestones such as munch and chew. Oral motor development is linked with complex tongue movements. It learns to stabilize the jaw and directly influences feeding response. Factors influencing oral motor skills. In addition to appropriate and successful practice, other factors can also negatively influence oral motor skills development. Structural alignment. Support for function in the mouth come from the structure below. Sensory motor input. Integrated sensory information is essential for developing motor planning skills that incorporate both motor control and motor learning. Medical influence on oral motor patterns. Sensory inputs from the respiratory and gastrointestinal tracts directly influence oral motor patterns through the swallowing center in the brainstem. Muscle tone and oral motor patterns. Low muscle tone in the facial muscle can result in an open mouth. The resulting pattern appears as though the child is pushing food out in front of the mouth, such as oral motor pattern that is typical of many children with ASD. Therapeutic implications. Way to treat orofacial praxis deficits for enhancing the communication skill of children with ASD. Motor-based speech therapy like the prompt method use tactile kinesthetic cues to assist the child with the orofacial movements during speech. Other forms of treatment include repetitive practice of single as well as combined facial movements in a particular order series of patterns. Discussion. Children diagnosed with ASD face profound challenges with orofacial praxis impacting communication skills. These deficits are associated with impaired motor learning. Early diagnosis using standardized assessment tool improves the intervention effectiveness and accuracy. There is documented improvement in expressive speech as a result of motor-oriented interventions. Caregiver and the use of AAC systems are critical for nurturing supportive communication. There is a need for further longitudinal and neurobiological studies to refine treatment individualization strategies for children with AAC. Conclusion: orofacial skill is an area of child development that impacts speech output. In children with ASD, the lack of orofacial skills severely impacts the ability to communicate and socialize. Precise evaluative measures and prompt remedial solutions serve to be very effective. Motor-based therapies, augmentation of communication methods, systematic oromotor exercises are vital steps within the intervention plan. With advancing understanding of the neurological and development factors associated with orofacial skills, clinicians will have comprehensive framework to support social and communicational engagement of children with autism. Shifting focus to the role of orofacial skills help improving the quality of life of children suffering from autism.